Hey, coming to you to talk about endotracheal tube placement today. So when we talk about providing general anesthesia, and especially when we start talking about using neuromuscular blockades during our general anesthetic, we obviously are rendering the patient helpless at this point in time, and they're not going to be able to breathe on their own or have spontaneous ventilation. So we're going to use some kind of airway device to actually establish a way to ventilate them during this case. So we're going to look at this as a patient that we're inducing general anesthesia on. Then what we're going to do at this point in time, we're going to place an endotracheal tube, put them on a ventilator, give them some inhalational agent for an anesthetic gastro in this case. But we want to go over this first step, which is actually establishing the airway. As we talk about establishing the airway, we need to remember that there are a couple of different kind of tools that you need to have and have them readily available. So the first one I want to talk about is actually your blade that you'll be using or your laryngoscope that you'll be using. Now there are a couple of different types that you can use, but I'm going to talk about two of the basics here today. So I like the Miller 2. That's my blade of choice. I use it for a number of years. And what I want to talk about really is Miller 2, and I'll talk about a Mac 3 and tell you a little bit of the difference. So when we look at laryngoscope handles and blades, and we talk about direct laryngoscopy of our patient, or what you'll hear us call it DL sometimes, we look at these and we first need to make sure we've got a handle. And here's your handle here. And this is going to actually have batteries or something within it that actually help provide a light source. And we'll talk about that here in just a minute, or power to our light source. So this is a Miller blade. This is a straight blade, as you can see. I'm going to talk a little bit about the difference in the way we use these in a few. Then we also know that they have a light on the end, or we see a light on the end. This is going to help illuminate our oral airway as we're down there looking to make sure that we're identifying the trachea versus the esophagus. So this is a straight blade or a Miller blade. Now, the other one that you can use is a Mac blade. As you can see here, still we have the handle, the laryngoscope handle. We also have the blade that has a light on it, but the difference is this actually has a curved blade to it. And this will be used in a little bit of a different fashion than what we see for the Miller blade. Now, the other things that we need to have is we want to make sure that in case we're having a little bit of trouble getting the airway in and we've got to continuously bag mask ventilate this patient, we want to make sure we've got an oral airway that is of an appropriate size. And then, obviously, we're going to be placing an endotracheal tube. So we'll need an endotracheal tube. We'll need a stylet that we can actually put down into the endotracheal tube. And then we'll need a syringe on the cuff to inflate or a syringe on the pilot balloon here to inflate the cuff after we insert the tube. So what are our steps here? So now we've got a patient that we have induced general anesthesia. We've given them something like lidocaine, propofol, and rocuronium to induce general anesthesia. They're unconscious and they have a neuromuscular blockade on board. So the next thing we're going to do is we're then going to pick up our blade and we're going to then open it up to make sure that we've got our blade in the optimal position and that it has its light working, and we hold our blade in our left hand. The next step we're going to do is we're going to scissor the mouth and scissor what's called the teeth, the mouth, whatever terminology is being utilized at your facilities. We're going to scissor the mouth, which really is taking my fingers and I'm putting them in a scissor format so I can actually move them this way. All right, if you can see that in the different angles. And what I'm doing is putting it in their teeth so I can open the mouth up wider to be able to get this blade within that mouth without hitting the teeth or causing major damage. So now I have scissored the mouth open. Then I'm going to take my blade and I'm going to slide it in the mouth over on the right side. I'm going to keep sliding it down. And then I'm going to put my hand, right here behind the occiput, and I'm going to put them in that sniffing position by taking the occiput of the head and pushing it forward a little bit. So now I've got basically their nose pointing towards me. As I slide in, I am going to then get into my position and I'm going to lift up and out. I am not going to rock my hand back, but I'm going to lift up and out and look to see if I see the vocal cords. Now, what exists down there is an epiglottis, and the epiglottis is covering the vocal cords. So I literally am taking this blade, I am putting it right underneath the epiglottis and lifting the epiglottis up out of the air, out of the way, so that now I can get a close and a very good view of my vocal cords. Now that I have my vocal cords and I can see my vocal cords, I'm going to take my endotracheal tube, again, now sliding it in the oral airway here. Now, during this whole spot, what I want you to also make sure you're doing is taking a look at the lips here and making sure that with this blade, you're not pinching the lips against the teeth with the blade here so that you're protecting all of this area up here and not causing any trauma to the lips, and you're also not causing any trauma to the teeth. So now I can see that I've got a good view. I'm clear up here, not causing any trauma, pinching on anything. So now what I'm going to do is I'm going to take my endotracheal tube, I'm going to slide into the oropharynx, and I'm going to guide it with that stylet all the way through the vocal cords. Now, as soon as my balloon, as soon as my pilot balloon there, my cuff, excuse me, gets through the vocal cords, then I'm going to stop. I'm going to gently pull my blade out while holding the endotracheal tube. I'm going to pull my stylet, and I'm securing it so that when I pull my stylet, I don't also pull my endotracheal tube out. I'm going to then inflate the pilot balloon, which is then going to inflate the cuff. The cuff is right below the vocal cord, so now this is preventing it from truly coming out at this point in time. And then I'm going to connect my reservoir bag and connect my circuit up and squeeze my reservoir bag to make sure I am moving air. And I can see the lungs inflating here and rising. So I know that I've now put my endotracheal tube in successfully through this technique.